Doctor, I've not been able to maintain my oral hygiene, or my teeth have worn out and I've kept them like this for a very long time. I went to the dentist and now the dentist has advised me to get full mouth rehabilitation done. Now, I really don't know. There was a lot of jargons being exchanged and I could not understand what it actually means. Could you please elaborate on that? Hi, my name is Dr. Rudra Mohan, and today through this oral health channel, I'm going to be talking about full mouth rehabilitation. Let's start. So basically, who requires full mouth rehabilitation? Full mouth rehabilitation is required by patients who've unfortunately either their teeth have worn out with time, or at the same time they've lost a lot of multiple teeth due to caries or trauma or any other periodontal disease. At the same time, their whole neuromusculature structure of this whole complex of the face and the jaws is disturbed because of the fact that you've had a lot of dental problems, due to which there has been loss of teeth and there has been shifting and tilting of teeth, and the bone below it has also undergone modifications, due to which the whole balance between the upper and lower jaw is disturbed. So when we talk about full mouth rehabilitation, basically we are trying to restore the most natural way of the way you smile and you intercuspate or basically chew on your teeth. Now, there could be multiple reasons. As I've said, that you could have had bad oral hygiene for a very long time, or maybe you've worn out your teeth over a period of time because there's something known as bruxism and other parafunctional habits that lead to loss of tooth substance. Also, you could have just bruxism and your jaws are intact. That means the health of the bone is basically, there's adequate bone present in your jaws, leading to a good vertical dimension at occlusion. But at the same time, in some cases, even this is compromised due to either periodontal disease or any other factors. The most difficult cases to actually diagnose and plan are the ones where you've had multiple loss of teeth in singular places and the bite has collapsed in that area. So I'm going to be talking about, in very layman language, about what needs to be done and what is actually happening when you're undergoing a full mouth rehabilitation case. So a full mouth rehabilitation case actually requires a multidisciplinary team of dentists of different types of fields of dentistry, such as endodontists, prosthodontists, periodontists, oral surgeons, implantologists, and they work in tandem to make sure in a sequential manner that your smile, at the same time your functionality of your dentition, is restored. Now let me guide you through the whole process. We take a brief history and do the careful examination and take the adequate number of x-rays to see what is the case that is present to us. Either it could be worn out teeth, or multiple loss of teeth, or lot of carious teeth, or worn out teeth with loss of the jawbone. So after this, we do a face bow recording. Basically, a face bow recording is where we are trying to see how your we are trying to transfer the way your natural teeth occlude onto an articulator, or with the help of into an artificial simulation of the same way your teeth are binding. Also, we require to take a centric relation. A centric relation is basically the most retruded position of the mandible. To bring it out in the most simple words, when your upper and lower jaw are in the most relaxed position and in harmony with each other, that is the time where your lower jaw is basically in the most retruded or the pushed back position, where it is nicely articulating, or rather joining with the upper jaw and the face. And this is known as centric relation. Now you would want to say, how would I know? It's very simple. We are there as experts, but if you want to really know what the most accurate or the closest way you would not want to know how your centric relation works is when you swallow your saliva. So when you swallow your saliva, basically that swallowing action retrudes your lower jaw and it kind of stimulates the whole centric relation. After doing the centric relation, we do a diagnostic wax up. Basically, we take the impressions of your upper and lower teeth and we do a diagnostic wax up so that we know what needs to be done in what area of the jaw and what corrections need to be made. If you are a patient who has had worn out teeth or teeth with a lot of caries, there's a high likely chance for a full mouth rehabilitation case. You might have to undergo multiple RCTs so that your whole experience becomes painless. At the same time, when you get the final caps and restorations, there is no chance of any sensitivity or any pulpal symptoms. So we go ahead with the preparation of the teeth, and then we do the temporization, and then we take the final impression, after which we pour the cast, and then we actually do the proper face bow transfer and the centric relation. As I've already mentioned, we need to know how your teeth intercuspate. So your teeth don't only serve the purpose of just eating your food and swallowing, helping it swallow. At the same time, it helps whatever your lip seal is, because you have to speak with your teeth, especially the alphabets or the phonation of the sounds with starting with S, M, T. All these sounds require a harmonious functioning of all the teeth, how your anterior teeth intercuspate and all those things. So we record all that. After all your relations are actually established with everything, we have a workable cast over which now we have all the teeth replicas in position. We put the metal copings and we take a metal try-in so that we know that everything seems all right, and we know where exactly we need to place the ceramics so that your whole smile is, it comes back. And we also do whatever the occlusal adjustment. After the occlusal adjustment is done, we do the final glazing and polishing, and now your teeth are ready for cementation, and now you can smile and chew with those teeth. Mind you, this is a very tedious process, and I have tried to explain it in the most simplified manner. So any dentist watching it out there, please try to understand that I'm trying to put it out for the general public. So that's why I cannot use much of dental jargons and the technicalities, and please forgive me if I'm missing out on any essential info, which I don't think so, because I've researched my topic from credible sources. Now coming to the cost, it is a little expensive, but then again I'll tell you something very honestly. If you want to get a nice smile, if you want to regain that lost confidence, and you know that unfortunately you've been at the bitter end of not being able to maintain oral hygiene, or for whatever reasons that are beyond your control, that your teeth and oral hygiene and the way your upper and lower jaws health have been compromised, please go ahead with it. Don't look at the cost, get the treatment done, because you will regain that lost confidence. And I'm telling you, the way you chew your food and the way you smile, these are very important when it comes to quality of life, right? When you go out in the society, in the public, the way you smile, that's your first impression that comes across. So if you feel that your smile is compromised, or the way you look, or the way your teeth look are compromised, please go ahead with this treatment if it is required for you, and make sure you get it done right. So this was today's episode. Please like, share and subscribe, and don't forget to press the bell icon so that you can get important messages and updates. Please write your queries and apprehensions in the comment section. At the same time, if you want to reach out to me, these are my social media handles and my WhatsApp number. However, I might not be directly be able to take your call. Please message before calling. And this was today's episode. Have a nice day.